My name is Jenna and I'm 20 years old, and I am a healthcare advocate, a chronic illness warrior, and a former IWK kid. I was an IWK kid from the time that I was born. My mom tells me I was in that emerge probably every month for the first 2 years of my life, and struggled a lot with my mental health throughout elementary school. Suffered with quite a bit of bullying, struggling with my body image and an eating disorder, and struggled with depression through junior high and high school and the parts of early adulthood. So the IWK was really there for me through all those parts. Trying to find my place in the world was really, really rough. I was quite different and didn't fit in with the types of activities everybody was doing, but I kind of did my best to find my way. I ended up finding volunteer positions at the IWK, which is what introduced me to the advocacy world. And then throughout university, I've been kind of traveling around Canada and sharing my story, and that's given me a lot of purpose. My support system has really been my mom. She's been there for me through thick and thin and everything. We're kind of been through it all together and been through the good days and the bad days, but she's been so helpful to me. I was a self-harm survivor and a suicide attempt survivor, and I went through a lot of ups and downs throughout my young life. So I went through a lot of different therapies through the IWK, and I've actually been involved with building the integrated youth services as a youth partner.
My name is Maureen Brennan, and I'm Director of Mental Health and Addictions at the IWK. Jenna's story is an amazing story for us to learn from, to actually have her experience, to understand what has worked for Jenna and what hasn't on her journey. Actually helps us shape the services in a way to improve them and to be more responsive in ways that maybe Jenna didn't have access to during her time. IYS provides a suite of support services. These services can be social services, wellness services, or physical and sexual health services that really meet kids where they're at to provide a response to their needs right from day one. IYS offers an opportunity to meet someone on day one and assess what might be helpful for them and to connect them to a level of services that might fit their needs. The idea is to uniquely understand what would work for this youth, what the caregivers might need in a level of support, and connect them in that one location.
It's really important that we set youth in our communities up for success. So all 8 of the locations are going to be in places near schools and near other locations that youth normally are, so that it's not hard for them to go, and you can just walk in and be welcomed by, a smiling face, or we'll have a door that you can come in and maybe not say hi if that you're having a rough day. But for me, I think it really would have meant being less confused, knowing exactly where to go.
We've had youth advisory councils that actually come together to help us build the space, understand what the space needs. Everything gets co-designed and integrated with the youth, helping to shape what we do. The IWK is uniquely positioned to be the backbone of IYS Nova Scotia because we're one of 13 children's healthcare hospitals.
Healthcare doesn't need to always be like clinical medical stuff. It can be bringing youth in for a cooking class, because then youth are getting to know the people in their community, and then they have more people to rely on when they need help.
IYS lends itself quite nicely to provide that support and services for those youth and caregivers who might need more support and services during that time. So you have seamless and integrated services out of one location to support youth.
I really think that those services are really going to change the game for a lot of people, and I think having that one-stop shop would have been incredibly helpful for me.
The IYS site relies upon youth like Jenna to actually contribute to the design and to the implementation of the sites.
You're not only investing in, a hospital, you're investing in people's futures, lives, your local community. If you live in the Maritimes, you are so beyond blessed to have the IWK in your corner. It's always there for you. But also remember, your life doesn't need to be defined by your illness.
The world is a complex place, and youth have a lot to navigate with a lot of pressure on their shoulders. IYS is a site that can meet them where they're at and provide immediate access to support and services that might be needed.
Helping others helps you heal, and that's something that's near and dear to my heart.